Long-term use of D3, K2, and magnesium, is it safe or slowly harming you? Many seniors rely on these supplements every day, trusting they support their health and vitality. Yet many older adults can't even remember when they first started, and few stop to consider whether continuous use for months or even years might quietly harm their bodies. Even natural supplements can create problems over time if we don't understand how to use them correctly. In this video, we'll break it down in 5 focused sections, starting with Section 5 and working our way to Section 1, the most critical information you need to know. Quick disclaimer, this video is for educational purposes only and is not a substitute for medical advice. Section 5, why supplement cycling might be the secret to better results. To understand why problems can develop over time, especially for seniors who often follow long-term supplement routines, we need to talk about something most people have never heard of: supplement cycling. It might sound complicated, but it's actually very simple. Supplement cycling means you don't take a supplement non-stop forever. You take it for a period of time, then you pause. You give your body a chance to reset, and if needed, you start again. Think of it the same way you think about rest. You work, then you rest. During rest, your body repairs itself, adapts, and comes back stronger. Supplements work in a very similar way. In fact, health experts from the United States National Institutes of Health have explained that long-term supplement use without periodic reassessment can sometimes lead to nutrient imbalances or unintended side effects, which is why monitoring and adjusting supplement intake over time is important. Here's the thing. When your body receives the exact same input every single day, month after month, something older adults often experience, it eventually adapts. The benefits can start to weaken, while the chances of side effects quietly increase. That's why taking a break, even temporarily, can actually make supplements work better when you resume them. There are 3 main reasons supplement cycling can protect your body. First, adaptation. Your body is incredibly smart. When it receives the same substance every day, it adjusts. Over time, the response becomes weaker. You've probably experienced this with coffee. 1 cup gives you energy at first, but later even 3 cups barely make a difference. Supplements can behave in the same way. Second, hormone balance. Some supplements influence hormone systems in your body, including those connected to sleep, mood, and energy. Continuous intake may signal your body to reduce its own natural production, quietly throwing off your internal balance. Third, side effects. Magnesium can cause digestive upset for some people. Vitamin D3 can lead to constipation or discomfort for others. Taking short breaks allows your body to rebalance and recover, often improving how well the supplement works when you resume. Cycling isn't about stopping supplements out of fear or confusion. It's about using them intentionally, in a way that supports your body's natural balance instead of overwhelming it. Now let us move to Section 4, which affects something most people get wrong about vitamin D3. Section 4, vitamin D3, the most misused supplement. Now let's talk about vitamin D3, a supplement that's very different from both vitamin K2 and magnesium, and one that's often misunderstood, especially among seniors who often rely on daily supplements to support long-term health. Vitamin D3 isn't just a vitamin. In many ways, it acts more like a hormone. It influences thousands of genes and regulates some of the most important systems in your body. It supports immune function, helps maintain strong bones, protects heart health, and stabilizes mood. Because vitamin D3 is fat-soluble, your body stores it in fat tissue in the liver. Unlike water-soluble vitamins, which are flushed out daily, vitamin D3 can remain in your system for weeks or even months. This is where problems can quietly develop. Many people take D3 daily without realizing they already have sufficient levels, especially if they get regular sun exposure. Over time, this can lead to taking more than your body actually needs, which may slowly create imbalances. Clinical guidelines from the United States Endocrine Society explain that long-term high intake of vitamin D can raise calcium levels in the blood, potentially causing digestive discomfort or other metabolic issues. This is why monitoring your levels and adjusting your intake is so important. Daily high doses aren't always necessary, and understanding when to adjust, pause, or cycle D3 is crucial for long-term health. Blood tests showing 25-hydroxy vitamin D levels above about 50 nanograms per milliliter may indicate that your intake needs adjustment. Here's a simple approach. You can pause supplementation for 2 to 4 weeks to let your body rebalance. Another option is to reduce your daily dose to a lower maintenance level, usually 1,000 to 2,000 IU per day, instead of higher doses like 5,000 IU. Some people do well taking vitamin D every other day, which can maintain healthy levels without constant daily dosing. It's also important to remember that vitamin D needs vary from person to person. Those with limited sun exposure usually need more than people who get enough sun. Seasonal changes, age, and absorption efficiency all play a role. Older adults generally absorb vitamin D less efficiently than younger people. Understanding these nuances helps you get the benefits of D3 without risking unwanted buildup. Now let us move to Section 3, which explores whether cycling and long-term use of vitamin K2 really make a difference for your heart and bones. Section 3. Is cycling vitamin K2 significant or not? Think of K2 as a traffic officer inside your body. Its main job is to guide calcium to where it belongs, your bones and teeth, so it can strengthen them. Calcium is not meant to build up in your arteries, kidneys, or other soft tissues. Yet that is exactly what can happen if K2 is missing, particularly in seniors whose nutrient absorption and metabolism change with age. This is why vitamin D3 and K2 are often called a power pair. Vitamin D3 helps your body absorb calcium, but K2 tells that calcium where to go. When D3 is taken without enough K2, calcium can end up in places you don't want it, especially over months and years of use. For older adults, maintaining this balance is critical to keeping bones strong and arteries healthy over time. Research from the long-running U.S.-based Framingham Heart Study has shown that higher vitamin K intake is associated with stronger bones and healthier arteries, highlighting its critical role in calcium management. So, is cycling K2 significant or not? For most people, the answer is no. It doesn't need to be cycled. Typical daily doses, usually between 90 and 200 micrograms, are considered safe for long-term use. Unlike some other fat-soluble vitamins, K2 doesn't accumulate to harmful levels, so regular supplementation is generally fine. There are a few situations where occasional breaks can have a noticeable effect. If you're taking high-dose vitamin D3, pausing both supplements briefly can help your body rebalance calcium management. If you're on blood-thinning medications like warfarin or Coumadin, K2 can affect their effectiveness, so your doctor should monitor your INR levels closely. Vitamin K2 is also rare in modern diets. Most people don't get enough from food alone. Populations that eat fermented foods like natto show stronger bones and healthier arteries, demonstrating how significant this nutrient can be over the long term. In short, K2 is safe for long-term use, and cycling is usually unnecessary, except in specific situations where a short pause can have a noticeable impact on your body's balance. Up next, we'll dive into magnesium, the mineral most people are actually deficient in, and why its long-term use can be both beneficial and tricky if not managed carefully. Section 2. Magnesium. Why cycling works differently. Magnesium is one of the most essential minerals in your body, and also one of the most commonly overlooked, especially for seniors who often struggle with maintaining proper mineral levels. Magnesium is involved in more than 300 chemical reactions that keep your body functioning properly. It plays a role in energy production, muscle movement, nerve signaling, blood sugar regulation, and deep restorative sleep. Simply put, without enough magnesium, your body can't run smoothly. It's like trying to drive a car without enough oil. It may keep going for a while, but strain and damage quietly build over time. What makes this especially concerning is how common magnesium deficiency has become. Modern soil contains fewer minerals than it once did. Processed foods dominate many diets. High carbohydrate intake increases magnesium loss, and chronic stress drains it even faster. As a result, many people, including older adults, are running low without realizing it. The symptoms of low magnesium are often subtle but persistent. Trouble sleeping, nighttime leg cramps, heart palpitations, unexplained anxiety, muscle tension, and ongoing fatigue. Because these symptoms develop slowly, most people never connect them to a magnesium shortage. Here's where magnesium differs from supplements like vitamin D3 or K2. Magnesium usually does not need to be cycled. According to the U.S. National Institutes of Health, in healthy adults, excess magnesium from supplements is efficiently removed by the kidneys, making daily intake generally safe. This natural regulation means toxicity is uncommon under normal use. In fact, stopping magnesium often leads to noticeable changes. Within a few days, sleep may become lighter or more restless. After about a week, muscle cramps and fatigue can return. After longer breaks, anxiety, physical tension, or heart palpitations may resurface. These signals reflect how consistently your body relies on magnesium to maintain balance. Rather than cycling magnesium, a better approach is adjusting the dose to your individual needs. If your diet includes plenty of leafy greens, nuts, seeds, and avocados, a lower daily amount, around 200 milligrams, may be sufficient. For many people, especially during stress, physical activity, or poor sleep, 300 to 400 milligrams daily works better. There is one important exception. If you have kidney disease or reduced kidney function, magnesium should only be taken under medical supervision. Now let us move to Section 1, where we reveal the most critical signs that long-term supplement use may be quietly overloading your body. Section 1. 4 warning signs of supplement overload. Even when everything seems normal, your body can quietly send warning signals that your supplements are starting to overload your system, especially in seniors whose bodies process nutrients differently. These signs are often subtle, which is why most people, including older adults, miss them or assume they're just part of aging or stress. First, unusual fatigue. You may be taking supplements to feel more energized, yet instead you feel sluggish, even after a full night's sleep. It's easy to blame work or getting older, but sometimes your body is struggling to process too many nutrients day after day. Second, digestive issues. Bloating, nausea, diarrhea, or constipation can all be clues that something is off. For example, magnesium oxide is known to cause diarrhea in some people, while too much vitamin D3 can contribute to constipation. These are often your body's way of saying balance has been lost. Third, disrupted sleep. You may have started magnesium to improve sleep, yet now find yourself tossing and turning or waking too early. Timing, dosage, or interactions with other supplements, especially high vitamin D3 levels, can interfere with your natural sleep rhythm. Fourth, heart irregularities. You might notice your heart racing, slowing down, or skipping beats even while resting. This can sometimes result from imbalances between minerals like magnesium, calcium, and potassium, or from interactions with medications. When your body sends these warnings, it's important to listen carefully. In many cases, taking a short break from supplements for a week or two can reveal which ones are truly helping and which may be causing problems. These signs aren't meant to scare you. They're meant to help you use supplements intelligently and safely, so you can get the benefits without the hidden risks, particularly for older adults who want to maintain their energy, digestion, and heart health. Before making any changes to your supplement routine, please consult your healthcare provider. To keep improving your health and getting the most from your supplements, watch the next video. Every tip can make a real difference. And make sure to subscribe to get more tips to keep your health on track every day.